Hey doc, I'm undergoing a hernia surgery. Why the hell are you concentrating so much on my sugar? Hi, I'm Dr. Rajeev Pullagura. I'm a general and a laparoscopic surgeon. The reason is very simple. High sugars before surgery can affect wound healing, increase infections, create problems during anesthesia, and slow down your recovery after surgery. So, sugar control is not just a diabetic issue, it is a surgery safety issue. Many people think, doctor, do the surgery first, I will take the control of my sugar later on. But the body does not work like that. Surgery is a planned stress for the body. During the surgery, the body has to handle anesthesia, cutting, stitching, healing, medicines, recovery. If the blood sugars are already very high, the body becomes weak in handling the stress. Healing becomes slow, infection risks become more, and sometimes even a simple planned surgery can be complicated. And at the same time, when the body's defense mechanism also becomes weaker, hence the bacterial infection increases in the wounds. But if sugar is on a very high side, the fighting power of the body also becomes slow. This is why diabetic patients with uncontrolled sugar need extra care before as well as after surgery. It is especially important in wound surgeries and diabetic foot problems. Diabetic foot problems, even a small wound can become a serious issue where they may lose a limb if sugar is not controlled. Even hernia surgeries, gallbladders, pile surgeries, or any other important surgeries, sugar control is a must. Another aspect is sugar control also matters for anesthesia. Before surgery, the anesthetist checks your overall fitness because anesthesia is not just about making you sleep and waking you up. During surgery, your heart rate, blood pressure, breathing patterns, body fluid balances are all carefully monitored. If sugar is very high, patient may develop dehydration, weakness, electrolyte imbalance, and sometimes delayed recovery. These are risks during and after surgery, in sometimes a week. This is not to delay your treatment. It is because we want to make the surgery as safe as possible for you. Let us say a patient comes with a planned hernia surgery. Hernia is not an emergency, but a surgery is needed eventually. During your pre-surgical workup, our patient has very high sugars. Now, if we ignore the sugar, directly do the surgery, chances of wound getting infected, delayed healing and recovery can occur. We first control the sugar, adjust the medications if needed, take a proper physician or a diabetologist into the loop, and then plan for the surgery. This is a small preparation, but overall it affects the results in a great manner. Before any planned surgery, diabetic patients should consult early so that their sugars are controlled. Doctor, surgery is tomorrow, sugar is high, what do I do? Is another question. If you know you have diabetes, or even if you're not sure or you have some symptoms of diabetes, get yourself checked. Inform your doctor regarding your sugar status. Your doctor may ask you for a fasting sugar, sometimes something called as postprandial sugar, and a HbA1c. It gives you an average control of the sugar period over the last 3 months. Also, take your diabetic medications properly. Follow your diet advice. Avoid sweet, sugary drinks, unnecessarily snacking before surgery. Do not hide your diabetes history from your surgeon, anesthetist, or any doctor in per se. Some patients say sugar is only slightly there, but they may not reveal that they are on medication. Please here to protect you and take you safely through the surgery. Another important aspect is never stop your medications, maybe tablets or insulin before surgery on by yourself. This can be dangerous. Before surgery, you may need to be fasting, and because of fasting, diabetic medication may need to be adjusted. Some medicines may be stopped temporarily, some may be changed, and sometimes insulin may be given according to the surgeon or the anesthetist and the physician's advice. Now, emergency surgery is completely different. Suppose there's a serious appendix infection, blocked hernia, a severe infection that requires an urgent surgery. In that situation, doctor may not wait for a perfect sugar control. Some may proceed with the surgery while controlling the sugar with insulin, fluids, and proper care. But planned surgery, we have time. So always it is better to optimize your sugar and reduce unnecessary complications before you plan for a planned surgery. I want to reassure you one thing. Diabetes does not mean surgery cannot be done. Many diabetics safely undergo surgery every day, but diabetes means surgery should be planned carefully with good sugar control, good monitoring, and correct medications with a diet advice so that your anesthesia and surgery process are done safe. So if you're a diabetic and you're planning for any surgery, whether it can be from a head to toe surgery. Always inform your surgeon, consult early, get your sugars under control, discuss with your medications, probably may require tweaking, follow up with a proper plan, and then prepare for your surgery to avoid unnecessary delayed healing, longer hospitalization, and unnecessary tension that follows surgery. Kindly share, like, and subscribe if you liked the video, and I hope this was useful. Kindly like, share, and subscribe the channel, and do follow. Thank you.